Good morning, everyone. It is October 9th, 2025, and I have a very important update for everyone. It has been a very bad past couple of days for the anti vax crowd, and here's why. First of all, uh, despite their um, petulant display at the ACIP meeting a couple of weeks ago, the data supporting use of COVID mRNA vaccination is so overwhelming for both safety and efficacy that even the committee, stacked with unqualified and hardcore anti vaxxers, had no choice but to vote unanimously to recommend that everyone over 6 months of age get vaccinated for COVID. Let me say that one more time. The CDC committee, loaded with anti vaxxers, voted unanimously that everyone be vaccinated against COVID. That had to be pretty disappointing to the anti vax crowd who thought that having that committee stacked with these unqualified anti vaxxers would end up with the opposite recommendation that the COVID mRNA vaccine be taken off the market. And it wasn't. They had no choice but to vote unanimously in favor of it because the evidence is so overwhelming. They couldn't, in any way, shape, or form, disregard it. And their argument and the evidence against using the COVID vaccination is completely flimsy, makes no sense, and has no data to support it. So, one bad thing for the anti vaxxers. The second shoe to drop, that's bad news for them, is today CDC quietly, they didn't want anybody to really hear that they kind of backtracked on this, but they said that even pregnant women should be vaccinated against COVID. Uh, why did they do that? Again, because the evidence is so powerful that vaccination of pregnant women improves the outcome for their babies. You don't want to have a baby. You don't want to get COVID when you're pregnant. It's not a good thing for your baby. So there's two. And then finally, this morning, a major study with millions of people enrolled in it showed that PAXLOVID is incredibly effective at reducing bad outcomes in patients with COVID. Significant, I mean, statistically significant, enormous benefit in not being hospitalized, not being on a ventilator, not getting really sick, and not dying. The difference between the Paxlovid treated group and untreated patients wasn't just a little bit, it was gigantic. For some of the endpoints, the difference was five-fold different and more. So it's quite clear. Something that anybody who has had COVID, I have never had COVID that I'm aware of, but someone who's had COVID and taken a Paxlovid will tell you the stuff works really well. I've prescribed it hundreds of times, and I can tell you it works really well and fast. It just shuts down viral replication. It's why it works so well. But this study is really important. And for some reason, because of what anti vaxxers have said and done, Paxlovid is really underused. A lot of physicians don't use it, won't prescribe it to patients who are sick with COVID. And that makes no sense. As long as you're not pregnant or have significant renal disease, Paxlovid is a relatively safe medication. It works dramatically well and has a very powerful effect on not on preventing you from being really sick. So today, this big study comes out that shows that Paxlovid really, it just reconfirmed the data we already have and the clinical experience that clinicians like me have who take care of COVID patients. Paxlovid works great. And it's really important because it's the proof that we needed to really show in black and white that it works. And contrast that with the other early treatment for COVID with ivermectin and hydroxychloroquine and whatever gobbledygook and dandelion and other silliness that the early intervention, early treatment for COVID recommended by Dr. McCullough and Corey and Malone and all those other ones. There's no evidence that that stuff works at all. There's no benefit in any well done studies. And yet, some people, a lot of people obviously put their faith in that junk. But we now know that junk doesn't work. First of all, has no pathophysiological basis why ivermectin, an anti-parasitic drug, should work against COVID. But anyhow, that stuff doesn't work. The other early treatment has been blown out of the water. The real early treatment is Paxlovid. So bottom line is COVID is not gone. There are millions of Americans who are walking around hosting, maintaining, replicating, mutating, and disseminating this virus. This virus is still very bad. It can still kill you. A couple hundred people are dying every week in the United States still from COVID. So it's not gone. You can still get it. It's mutating. And your best protection against COVID is number one, get vaccinated. Do what the CDC, ACIP, including Dr. Malone, recommend. Get vaccinated. Everyone over 6 months of age. Dr. Robert Malone said and voted yes that you should be vaccinated against COVID with the mRNA vaccine. Everyone over 6 months of age. Number two, if you get COVID and you get sick and you're at risk for progression to severe disease and you're feeling really bad and you're a good candidate for it, go get a prescription for Paxlovid. If your doctor is not up to date, doesn't read up to date, and won't give you a prescription and you can't get a prescription, call one of the telemedicine companies like Teladoc and MD Live. There are others as well. They will now prescribe COVID Paxlovid for patients who are appropriate candidates for it. And then finally, don't take unproven, ineffective. They're not just unproven, they're proven to be ineffective. Ridiculous treatments like ivermectin and hydroxychloroquine, they don't work. If you took that stuff and you think it worked, that's not a controlled trial. That's not well done, executed retrospective study. That's the placebo effect. It was coincidence. You would have gotten better anyway. So anyhow, that's the message for today. Bad day for anti-vaxxers.